On July 31st, 2025, President Donald Trump declared a sweeping 200% tariff on all pharmaceutical imports from countries that refuse to relocate drug manufacturing to the U.S., effective immediately. "It's simple," he said. "If you want to sell medicine in America, you build it in America." But this wasn't just about jobs. It was a shot fired at the core of global health access. Within hours, stock markets trembled, allies pushed back, and public health experts warned of dire consequences, from rising drug prices to collapsing global supply chains. As countries like Canada and Australia mounted a resistance, one question loomed. When medicine becomes a weapon, what happens to the people caught in the crossfire? For decades, the pharmaceutical trade between the United States and its allies operated on a delicate but functional balance. Countries like Canada and Australia supplied billions of dollars worth of prescription drugs to American hospitals, pharmacies, and insurers, often under tightly regulated pricing systems that balanced profit with access. The U.S., in turn, provided the largest market in the world, enabling scale, innovation, and capital for global drug companies. Australia's Pharmaceutical Benefits Scheme, PBS, launched in 1948, became a global model, offering subsidized, high-quality medications at low prices. Canada similarly maintained a tightly controlled pricing environment, designed to make drugs accessible to its entire population while avoiding the volatility of U.S. price spikes. Despite these differences, the system worked. Trade flowed, patients benefited, companies profited. But as political tides shifted in Washington, that balance began to crack. During Trump's first term, aggressive rhetoric on drug pricing began targeting foreign producers. His administration accused allies of freeloading off U.S. innovation. By 2020, the idea of reshoring pharmaceutical production had entered mainstream policy debates. COVID-19 amplified these calls. The U.S. suddenly realized its dependence on foreign supply chains for even basic drugs like acetaminophen. Still, most efforts remained aspirational until Trump's return to office in 2025. What changed wasn't just policy, it was posture. The July 31st announcement didn't come through a regulatory process. It wasn't part of an industry roundtable. It was a blunt political maneuver, an ultimatum, not a negotiation. The 200% tariff wasn't just economic leverage. It was a declaration: comply or be cut out. For America's closest allies, it marked the collapse of a long-standing understanding that public health was a shared priority, not a point of pressure. Now, that assumption is being rewritten, one tariff at a time. The American gamble: tariffs as a blunt instrument. On July 31st, 2025, the White House stunned the world with a single-page directive. Effective August 1st, a 200% tariff would be levied on all imported pharmaceuticals from countries that refuse to relocate their manufacturing operations to U.S. soil. No exceptions, no phase-ins, no negotiations. The stated rationale was economic sovereignty. We will no longer tolerate foreign nations exploiting our people while outsourcing our health, Trump said during a campaign rally in Cleveland, flanked by steelworkers and veterans. If you want to sell your pills in America, you make them in America. In that moment, pharmaceuticals became geopolitical ammunition. The policy's design was rooted in economic nationalism and pandemic-era fears. During COVID-19, U.S. hospitals faced shortages of even the most basic medications, from antibiotics to sedatives, many of which were manufactured abroad. This experience seeded a powerful narrative that America's reliance on foreign drug makers was a national security risk. Trump's return to office emboldened this narrative. His economic advisors, many from industrial lobbies, argued that a tariff would pressure companies to reshore production, boosting American jobs, lowering long-term prices, and protecting national health resilience. But in practice, the 200% tariff was a sledgehammer. It failed to differentiate between life-saving generics and profit-driven blockbusters. It made no distinction between countries with fair pricing systems and those engaging in aggressive discounting. And worst of all, it ignored the complexity of pharmaceutical supply chains, where ingredients, components, and production are distributed across dozens of countries. Almost overnight, chaos set in. Large pharmaceutical firms like Pfizer, Bayer, and AstraZeneca halted expansion plans in U.S. markets. Some began redirecting investment toward the EU and Asia. Others warned that even U.S.-based operations would suffer, since many raw ingredients came from now tariffed regions. Hospitals across the U.S. began stockpiling essential drugs. Insurance companies forecasted premium hikes. Pharmacists reported panic buying. Share prices for health insurers dropped 3 to 5% in a week. Critics across the spectrum condemned the move. The American Hospital Association called it a reckless disruption of patient care. Conservative think tanks worried about market distortion. Liberals accused Trump of holding sick Americans hostage for a campaign headline, but the administration doubled down. Globalists want to scare you, Trump tweeted. This will make drugs cheaper in the long run. In reality, long-run gains were speculative at best. Immediate consequences were not. The U.S. had fired the first shot in a global health trade war, and the world was now choosing sides. Canada's response, quiet fortification. Canada's response was subtle but strategic. While Australia took a public stand, fiercely defending its pharmaceutical benefit scheme, PBS, and calling Trump's move medically unethical, Canada didn't issue a single formal protest. Prime Minister Mark Carney, himself a former Bank of England governor, knew better than to engage in tit-for-tat diplomacy. Instead, Ottawa built a firewall. Health Canada convened a closed-door emergency session on August 1st with senior officials from global affairs, major hospitals, pharmaceutical distributors, and industry stakeholders. The objective: to ensure Canada's drug exports continued without triggering economic retaliation, while protecting domestic access. The strategy had two tracks: technical reclassification and inventory management. Canada immediately began updating its essential medicines list, identifying products most likely to be targeted under the new tariff rules. Officials then quietly restructured shipping codes and export routes for certain medications, shifting some trade flows through multinational subsidiaries to avoid drawing attention. For example, generics produced in Montreal were rerouted via European supply hubs before reaching U.S. hospitals, legally and without fanfare. Humanitarian framing and back-channel diplomacy. Rather than argue from a trade perspective, Canadian diplomats focused on the human cost. In private conversations with the U.S. Department of Health and Human Services, Canada's envoys emphasized the impact on vulnerable American patients, especially rural clinics and low-income elderly populations that depended on Canadian generics. The messaging was simple: this isn't about protecting Canada, it's about preventing unnecessary suffering in America. Meanwhile, Canadian pharmaceutical companies took proactive steps. Apotex, one of the country's largest drug makers, froze prices for all domestic generics and prioritized supply to provincial health systems, anticipating potential shortages if U.S. demand surged. Other firms accelerated R&D partnerships with European biotech labs, signaling a pivot away from U.S.-centric investment. This dual-track strategy, technical adaptation and moral leverage, worked. For now. By late August, while tariffs officially remained in place, enforcement became selective. Some U.S. hospitals quietly negotiated exemptions or waivers for Canadian imports. Lawmakers in states like Vermont and Minnesota petitioned for carve-outs, citing public health risks, and whispers began circulating in Washington that the administration was quietly reviewing humanitarian contingencies. But Canada wasn't resting easy. Officials recognized the long game. Trump's tariff wasn't a glitch. It was a signal of deeper instability in the U.S. trade relationship. So, Canada doubled down on diversification. New agreements with the EU and South Korea were announced, aimed at expanding non-U.S. pharmaceutical markets. Health Canada launched a $2.5 billion fund to scale domestic manufacturing of critical APIs, active pharmaceutical ingredients, and to insulate its supply chain from U.S. policy shocks. While the U.S. rattled its allies with brute force, Canada responded like a submarine, silent, calculated, and moving beneath the surface. Stalemate. Unyielding policy. Unintended consequences. As August drew to a close, the pharmaceutical tariff war entered a strange equilibrium. Loud on the surface, paralyzed underneath. Trump's policy remained officially intact. The 200% tariff was still law, but implementation became spotty, riddled with exemptions, loopholes, and quiet exceptions. The administration, facing backlash from hospitals, insurers, and governors, even some Republicans, softened its tone without admitting retreat. Canada and Australia, meanwhile, stood firm. Australia ramped up its rhetoric, framing the PBS not just as a national program, but a human rights standard. Canada refused to enter public confrontation, yet quietly expanded its influence by proving it could maintain supply and integrity in a chaotic market. Multinational pharmaceutical firms found themselves trapped. Complying with U.S. demands meant disrupting global operations. Defying them meant risking market access. So many began stalling, lobbying, and hedging, redirecting long-term investment toward more predictable regions. Patients across the world began to feel it. Shortages, delays, price hikes. Meanwhile, trust in American health leadership faltered. What began as an act of economic coercion had now sparked a global crisis of confidence. No side was backing down, but everyone was bleeding. And the question looming wasn't just about tariffs anymore. It was about who could still be trusted to lead in global health. Impact on Canada, a hospital on the front line. At the heart of Toronto's downtown, St. Michael's Hospital began August 2025 with a new logistical nightmare. As one of the city's leading academic medical centers, St. Michael's typically balances tight margins, allocating generic drugs to thousands of patients per week, including many who cross the border from upstate New York for procedures and treatment. The Trump tariffs, though not aimed directly at Canada, sent aftershocks through the supply chain that rattled its pharmacy shelves. The problem wasn't immediate shortages, it was uncertainty. When Health Canada issued guidance to prepare for U.S. stockpiling and redirection, procurement officers at the hospital were forced to secure backup contracts and buffer inventory. Essential medications like insulin, statins, and antibiotics suddenly had unpredictable delivery windows. Drug wholesalers began prioritizing domestic Canadian orders, fearing that a sudden surge in U.S. demand would deplete national reserves. St. Michael's had to delay a major outreach clinic in Ontario's north due to supply concerns. Meanwhile, internal costs rose. The hospital's pharmaceutical purchasing budget jumped 8% in August alone, despite receiving the same volume of drugs. The added cost came from rush logistics, emergency resourcing, and hedging against back orders. Pharmaceutical firms like Apotex worked around the clock to keep shelves stocked, but the burden was shared downstream by administrators, by pharmacists, by doctors trying to navigate treatment plans with growing unpredictability. Canada didn't face a drug shortage, but it faced a psychological one, a sudden realization that even responsible, well-managed systems can be disrupted by political shockwaves they didn't cause. And perhaps most frustrating of all, this wasn't due to war or climate disaster or a pandemic. It was due to policy. Impact on the USA pharmacy owner's breaking point. In a suburb outside St. Louis, Missouri, Joe Yang's family-owned pharmacy had survived everything: Amazon's rise, CVS's expansion, and 3 years of pandemic panic buying. But nothing prepared him for the summer of 2025. When Trump's 200% pharma tariff kicked in, Joe assumed it wouldn't hit him directly. Most of his suppliers were US-based, and generics were still affordable until they weren't. Within 2 weeks, wholesalers began raising prices on medications that relied on even partially imported ingredients. Metformin, a common diabetes drug, spiked by 37%. Blood pressure meds rose 22%. And the cancer medication imatinib, sourced largely through Canadian and Australian intermediaries, became functionally unavailable. Joe tried to shield his customers by absorbing the costs, but by the third week of August, his margins were obliterated. Patients started skipping doses. One elderly customer, a retired bus driver, walked out in tears when told her medication, once $19 a month, now cost $61. The breaking point came when Joe had to deny a child's refill for a generic asthma inhaler. "We were told more would arrive in 3 weeks," he said. "We don't have 3 weeks." He isn't alone. A survey by the National Community Pharmacists Association in late August found that 41% of independent pharmacists had experienced significant disruptions in supply or pricing. Many were turning away customers or rationing stock. Ironically, the policy meant to strengthen American pharmaceutical independence had weakened the very system patients relied on. For Joe Yang, it wasn't about politics, it was about trust, and for the first time in 18 years, he wasn't sure if his pharmacy would survive the fall. The 200% tariff was meant to showcase American strength, but it exposed a system fraying at its edges. Canada, quiet yet unyielding, fortified its supply chains and stepped into a broader leadership role. Australia, vocal and unapologetic, defended its right to affordable medicine as a human right. Both allies held the line, not just for themselves, but for a principle, that health policy shouldn't be dictated by economic threats. Meanwhile, U.S. patients, providers, and small businesses bore the weight of a policy designed without them in mind. Shortages spread, prices spiked, trust eroded. North America now stands at a moral and economic crossroads, where political theatrics collide with the everyday reality of human health. In the race to shape the future, will North America win together or fail apart trying to go it alone? Are you American or Canadian? Share your story and your view in the comments below.